First of all, thank you for inviting me, Dr. Zan and Thomas. It's been quite a journey in my life to come to this part and being able to speak to an audience like this. Slightly intimidating every time I can speak to my peers with great ease, but to a group like this, it gets a little bit more intimidating. Nevertheless, I do have a great passion for what I do and what I have done in my career as a chef. I've been in the food industry for about 52 years. The first 26 years I spent in the kitchens, slinging pots and pans in the beginning, apprenticeship program, and for 26 years I really honestly could care less about nutrition and diet. We just wanted to make food taste good, look good, and happy customers to leave our restaurants or where we are. Then there came a burnout factor where I worked 6 to 7 days a week, 12 hours a day, and my family, especially my wife, said this is not going to work. So thank God I found a position at Johnson & Wales in our Charleston campus as a teacher, and I spent 26 more years in education and in leadership. And I told this to somebody this morning. I started as an instructor, and then I was promoted to department chair, and then my boss, supervisor, one of the provosts said, well, you're going to become the director, and I'm just telling you, in academics, we promote by incompetence. So if you're a bad teacher, you become department chair, and you work all the way up. I said, wow. I said, and you're the provost, so you must have been really, really great in what you're doing. But what was the genesis? When I started at Johnson & Wales, there was some aha moments, if you will, for me to change my mind. And that has become sort of like a passion of mine. There were personal challenges. Number one, I had family members die at a very early age. My mom died at 69 from intestinal cancer. My dad died from coronary heart disease. My brother died at age 58, lung cancer and coronary disease. I have a nephew who is in terrible shape. He's morbidly obese and is in the hospital, in and out. I have another nephew who's in his early 40s with throat cancer. So a lot of these, and I had other family members that have struggled with problems, including my own family with nutrition-related illnesses. The other thing when I became the dean, as I was moved up from from Charleston to Providence, was that when we started to go out to conferences and programs like this, I was inundated with the information of nutrition-related illnesses. And it really started to speak to me. First of all, I thought about my family, thought about myself as well. And I found out that nutrition-related illnesses have reached epidemic proportions. And obviously, and we found out this was like in 2015 or so, half of the all-American adults, 117 million, have one or more nutrition-related illnesses. That really struck a chord with me and with many of my fellow chefs and faculty members at the university. But I also realized there's a conflict between the food industry or within the food industry to address these issues. And that is, I think, where we, later on when I get into solutions, where we really need to start work together and come up with solutions that will help us, our world, to understand the data and the research that you have done. Our world is governed by meeting customer demands. A chef goes into his kitchen, he really, for the most part, doesn't really want to worry about what am I going to serve the customers in terms of healthy food is concerned. They're concerned about food costs, they're concerned about getting the banquet out, they're concerned about having enough staff in the kitchen that are trained, that can do what is asked of them. And what the bottom line is, and now they're asked to prepare healthy meals, which is a whole other subject, as you very well know. It's not as easy to answer. So my initial action or a reaction or action plan as the dean was, how can I address this within the university? So we started a nutrition degree, a culinary baccalaureate degree in culinary nutrition, and we're very, very successful. It's the only program to this day that students from that program, from a culinary school, can take a dietetic internship and then take the test as registered dietitians. My son went through this program and is now very, very successful. In addition to that, years later, I felt that we needed to take this whole program to the next level. And we, along with my department chair, looked at who we're missing as stakeholders in this program. And it was the medical field, was one big component that has never been part of our environment. So, and I'm not going to name the school we went to, but we went to a medical school, and we had an appointment with the dean, and asked the dean, we told her about our program and what we do and what we would like to do to move the program up. And I said, is there any connection, anything we can do together? And as Strömmer's standing here, she looked me square in the eyes and said, you teach people how to cook. We educate physicians. We have nothing in common. And that was like another aha moment. I said, wow, that's pretty interesting. I had a few other words about it, but so we went back and we started to regroup and figured, well, maybe we'd try this a little bit later. Then 3 months later, out of the blue, I get a call from Dr. Harlan, who was at that time director of the medical school in Tulane Medical School. And he called me out of the blue. He said, I'm Dr. Harlan. My dean has commissioned me to create this program called a Center for Culinary Medicine, but we cannot do this through the medical school. We need a culinary school to help us, and you're university level. And then he said, but also I wanted to tell you, I fully expect you to hang up on me. I said, and why would I hang up on you? And he said, well, number one, you're a chef, and number two, you're German. So you have you don't do cold calls like this. I said, well, number one, I know I'm German, but I'm not going to hang up. And we certainly, that's something we've been looking for quite some time. And for 8 years now, almost going on 10 years, we had a great relationship and started a great program. So to me, the benefits that have been is that we impacted a greater, healthier community and found cost savings across the board by creating this program. It was a new initiative and innovative opportunities for entrepreneurs to create new programs and new ingredients and new products. And we heard earlier, and I'm not going to belabor that, but the estimated annual healthcare cost was already mentioned before. My data said that it was $192.2 billion, or nearly 21% of annual medical spending in the U.S. This was quite a number of years ago and probably increased even more dramatically. So what did we do? When I went back and said, okay, well, how can I put my arms around this? I have to think in very strategic, straightforward plans. And I came up, have come up with these so-called 4 anchors before and applied them now to this particular program and to culinary medicine and what I would do as a chef and as an educator to help this and move this thing forward. To me, these four anchors are: number one is an anchor of confidence, where we master the basics; an anchor of endurance, where we master the challenges; an anchor of renewal, where we master the unknown; and an anchor of grace, for the lack of a better term, where we master the human heart, which is very, very important in giving back. So when we're mastering the basics, first of all, what is culinary? What does our world look like in one sentence or in one statement? Who are the stakeholders? Well, the stakeholders in our world are the farmers who make the food, the farmers, the ranchers who raise the cattle and livestock, I had the privilege of spending about 4 years at the Tyson Advisory Board for their animal welfare program. And it was quite interesting to see a large company, how they deal with creating or growing or raising food for us. Manufacturers, food processors, marketing people in the food world, that's still a big problem. I don't know if you see food commercials, and if you want to think, food commercials have not changed. It's all about still the big portions and value for your money, and where's the meat and where's all of that is really contrary to what we really are looking for today in creating a better environment. Total revenue in 2015 in the food world was almost $5.3 trillion and growing ever since. Food choices affect people. We heard about this all day long, and I don't need to get into much more detail in that. Food choices affect lives of people, the health, in healthcare as well. Food industry, my final conclusion, we have a tremendous amount of responsibility for the health of its customers and address the needs of the customers. So how can we encourage collaboration from my world? And I wear this white coat on purpose because it brings together, it's a reminder of two white coats. I think when many of you work, you wear a white coat. Well, we wear a white coat as well, and I like to bring the two white coats together in a much more tangible way. A few more suggestions in a little bit how we can do that. And how can we encourage collaboration between the medical and the culinary world, and aligning and partnering with the healthcare professionals and creating new products and ideas. So the second one would be anchor would be mastering the challenges. Nutrition information, and this is something that I struggle with all the time, is when I come to these conferences, the tremendous amount of research that has gone into that, in the information, the data that you have. But the information in our world is not going to be enough. We need to know how we tangibly and in a simplified manner can apply that to our daily work and to our daily production in our kitchens. It has to translate into a completely different lifestyle and a culture within our world. Simplify meal preparation and appeal to all of the senses. I always taught when I was teaching still in the classes that to our students that when you prepare food, you address not just the taste buds. All of the senses are being addressed. The hearing, the seeing, the smelling, the touching, tasting, everything is impacted by what you prepare. It's an artistry and it's science, but it also is very tangible, very fragile. And in the chef's world, it doesn't matter what we did yesterday. It doesn't matter what I can do tomorrow. It matters what plate I'm sending out today. And every chef and every student that we had, we drove home that whatever you send out, a piece of you goes out with you on the plate to the customer that's going to consume the food. Provide simple and focused evidence-based information. That is another big issue for us. Come into the conferences to this, it's really great, but I see also sometimes the different researches and the different outcomes and the different worlds that we live in and the different ideas and even the different research that comes out. For us, that is very confusing. So we need to make sure that we can work this out. Breaking down the silos in the medical school, we created the Center for Culinary Medicine. We have it now in 42 medical schools, 2 nursing schools, 12 hospital-based residences, and we covered almost 8,000 students. The schools include Cornell, Kent State, and many others. We had programs in Singapore and in London as well. One of the things that I want to close with is, in mastering the challenges, is that conference like this, I think in the future, we need to have what we have established at Tulane. That's a conference that both has the research and has the information, but we can do a hands-on conference where we go into the kitchens together and cook together and make this a much more interactive way of working together. And the focus has been on increasing and helping us understand what you have found and what we need to incorporate. And in closing, many of the information that has been given, it's still very, very confusing. Just put yourself in the shoe of an operator, and we heard about all the different diets and all the information. And the operator, you come into a restaurant with about 10 people or 20 people, and you tell the waitress and the waiter, said, look, we have 3 people that are on the Atkins diet. We have one person that's on the that has celiac disease. The other one is a vegan, and then we have 2 people, they have coronary disease and they can eat certain foods. What do you recommend on the menu? And I seen this on Facebook, and the waitress very clearly says, take a taxi. So I hope that we can continue the dialogue with questions, and then we can talk a little bit more about this. I hope this will help, and hopefully we can move forward with getting our world more involved in this.